Ready? Can you all hear me? So the goal of the next 5 minutes is that nobody ends up looking like this guy here in the picture. I am a content strategist and web writer, and I focus on writing healthcare content for consumers, mostly for hospitals, but the 5 practical suggestions I'm going to give you tonight you can use for almost any healthcare website. So the first question that we ask ourselves when we're dealing with any kind of website is who our user audience is. And for hospitals, patients and family members will make up the bulk of who you're really talking to. Obviously, there are other core segments, but that's really who you want to target your website toward. All right, so rule number 1, right? What do your patients really care about? Because what I find is that I go on hospital websites to do research and find out information, and every hospital website says basically the same thing. It's a sea of sameness. The first thing that they tell you is that we're the best at what we do, and the second thing that they tell you is that we're going to hold your hand while you're having this done to you, whatever it is. And while that's really nice messaging, it's not possible for everybody to be the best, and it's also not possible for every hospital to hold everybody's hand no matter what kind of procedure or service that they're having. So what do your patients really, really care about? Now this graphic is perfect because it shows exactly what happens. Hospital marketers put one thing on their website, and patients, in this case it's a university, but it's true for hospitals too, patients want to look for something completely different. We all remember the Venn diagram from 8th grade geometry. I do, not well. And you see that the intersection of what patients want to see and what the marketers put up there is just one little thing, and that's the name of the school or institution. In this case it would be hospital. So I love this because it's exactly what I do every day. These are the 4 questions that your patients ask, and I find this over and over again. I've written more than 50 medical websites. I've done usability testing on patients. I've looked at healthcare information. What do patients respond to? And these are really the basic. You can distill it down to this. What's wrong with me? Who's going to fix it and how? Who's going to pay for it? And I promise you, this is the question I always get. Is there free parking? That's really, if you can cover the logistics of what patients want to know in the most basic and simple way, you are right on your way to producing content that is not going to make anybody cry over their computer. All right, rule number 2, you want to work from a position of strength. How do you do that? You tell the truth, just like they did. Okay, so what does that mean? What does the truth look like? So you have to really define who you are. So if you're an academic medical center, then you should say, we're a big academic medical center, and you need to explain what it means to be a big academic medical center. We get a lot of money to fund studies, and we invest in technology, and our physicians are doing research on different diseases. What if you're a small community hospital? Then you talk about those types of things. We really are small, so each patient counts. We have navigators that know your name. We have free parking. And if you need to go in for a cancer treatment and you want to walk into the radiation clinic, we're really close by, and you're not going to have to traipse through 15 buildings to get where you need to go. So it's really, really important for hospitals to be really honest about who they are, because when you mislead patients and they end up coming to you for care, they're angry. And we all know there's nothing that you can do about all that bad word of mouth. Rule number 3, create what to expect step-by-step guides. If there was anything I could urge you to do, go home, go back to your offices, and to change your content, it's this. Patients come to hospital websites in a tremendous state of anxiety. They're nervous about their care, they don't really understand what's going on, they don't know how they're going to be treated, and they want somebody to explain it to them. So these could look, and you could use any type of content you want. Words, pictures, videos, SlideShare, whatever it is. Create these step-to-step guides for what patients can expect. So for one hospital I did what to expect the day of their mammogram, and it was a slideshow. The woman walking into the clinic room, what the clinic room looks like, what the machine looks like, what the dressing room looks like. Patients look at that, they already know when they're walking into the hospital what they can expect. And I always write for what you should bring for your appointment. I always bring a small snack when I'm writing this content. Patients love that. I've had a lot of patients during usability testing say to me, it's really good to know that the wait might be longer than I expected, and I'm glad to know that I should bring something to eat, because we all know what hungry and cranky patients are like, right? Not something you want in your waiting room. Don't forget, content isn't just text you've written. Now, I know there's a lot of chatter in the blogosphere about how to tie social media return on investment. That's for a different night and a different topic, but I do think that you should use whatever you have at your disposal to complement your content. So Twitter, blogs, patients blogging, doctors blogging, anything that you can use to sort of say to the patients we're giving you extra added information that isn't just about our hospital, but it's about your disease or your condition or support groups in the area that you can use. That's also very valuable. This is a very short story. Pictures are really worth 1,000 words. I had a 37-year-old friend who was diagnosed with stage 2 breast cancer. She wanted to go to Sibley because they had such calm pictures. She didn't care about the radiation oncologist. She didn't care about the physicist guys planning her treatment. She liked the fact that it was going to look calm to her, and that's how they got her. Final rule, cut through the blah, blah, blah. And what do I mean by the blah, blah, blah? The crap that is on your website that no one is reading. I tell my clients all the time, you're paying me for fewer words, not more words, even though I'm a writer. Because on a website, people can't stand the blah, blah, blah. And the best way for you to find that out is to look at your analytics. You will see where your patients are bouncing off, and you will get a really good sense of where you're stopping them from the pathways that they need to be clear to get at the information that they're looking at. Talk to your patients. I walk through hospital lobbies every day, and I really want to sit down and say to people, did you look at the website before you came here? Tell me what you liked and didn't like about it. Finally, you must read this. HHS produces health literacy online. Anyone who's involved in writing health websites or developing health websites should look at this report. It's absolutely fantastic. You can do a Google search on it. This is my final review of all my questions. And if you want to contact me after this presentation, after tonight, I will be here after, obviously, not like the other guy who left. But if you do, my contact information is there. So thank you very much.